Welcome to HPP690E. This is Aging in the U.S. Public Healthcare Programs. This is your Week 3 video. So Week 3, we talk a lot about aging services. Where do they come from? Who are these services? What do they do? A lot of these services came out of the Older Americans Act. That original law that we talked about quite a few times, passed in 1965. The Older Americans Act has been amended many times, and a lot of times new and innovative programs that support the aging community are amendments to the Older Americans Act. So one of the things we'll talk about is the Area Agencies on Aging. The Area Agencies on Aging was an amendment to the Older Americans Act that created these service organizations. There's over 600 now that support adults who want to remain independent in the community. So we'll go over a couple of examples this week in both Part 1 and Part 2. One of the biggest ones you should focus on are the Area Agencies on Aging. These are sometimes called the AAAs. In your discussion post this week, you're going to look up your local AAA and kind of see what they provide. AAAs were originally thought of as a referral and information service agency, kind of where a community would have a repository of people who knew the services and service organizations that could support aging adults in the community, meant to be local. However, they really are different. So just because you have seen an area agency on aging in your local neighborhood or you've worked with one, does not mean that's going to be identical to another area agency on aging. And really that was the intent. The intent with the federal law was the agencies on aging would be really flexible. They wouldn't give them a lot of rules about what they could and could not do or look like, because different communities are very different. So they wanted the AAAs to be able to adapt to their local area to best serve the population of aging folks there. Some of these AAAs have services in-house and some don't. In-house services, a lot of them will, if there are services in-house, it might be Meals on Wheels, nutritional programs. They'll have in-home care programs, transportation, legal services. Those can be within the AAAs or not be. If they're not in the AAAs, they usually have a close relationship and they refer out. Now, sometimes they can just share a building with a AAA because it's convenient to have those services all together. Often, a AAA will not also provide the Meals on Wheels program, but it just might be embedded within the AAA. One of the other ones that we will talk about this week is the National Council on Aging. Now, this is a very old, big example of a nonprofit agency, covers the United States, that does advocacy for aging adults across the country. The NCOA, it tends to focus on a lot of economic programs, and they have quite a few programs on their website that you can check out. Economic Security Initiative, Economic Checkup. They educate consumers about how to access the various benefit programs, Social Security, Medicare, and they have community service employment programs. So older adults that need to go back into the workforce or want to go back into the workforce, they do education and job training around that. Legal service agencies. So most states have a legal service agency that serves aging adults. These are usually connected to the AAAs, maybe not in the AAA, but sometimes can share a building or share space. They are funded slightly differently, but there's often close connections there. These are basically lawyer programs for aging individuals. Their goal is to protect the aging population in their choices about independence, how to make care choices, how to keep them financially secure. These are often income-based programs, so if you do notice when you do a little research about your area agency on aging and you see that there is a legal services program connected or within, these are income-based programs. So people who have over a certain amount of income or assets often don't get the free legal help. Now, some legal services agencies do help with information and referral themselves if you have more, if you are over at the asset or income limits. So they still do help with some legal services. Last I checked, there was over 1,000 legal services providers across the United States, so even more than AAAs. Some examples of legal services that you would probably see would be lawyers who help aging clients get public benefits, maybe drafting advance directives or those powers of attorney, helping out in housing disputes, discrimination, definitely involved in foreclosures if an aging person is about to lose their home. Sometimes they get involved in long-term care facility disputes, and definitely with abuse, financial exploitation, and fraud. Later we will talk about adult protective services and how their services might overlap with legal services. Another advocacy and prominent organization is an ombudsman program. So these are advocates for consumers of healthcare. Ombudsman you will often see connected to healthcare facilities, nursing homes, residential care, sometimes hospitals, sometimes home care. These are where the complaints go. And under the Older Americans Act, every single state and territory in the United States has to have ombudsman. Ombudsmen also do the investigation of healthcare complaints for aging individuals, people who access, again, those nursing homes, residential care, sometimes hospitals, and sometimes home care. They provide information to residents also about the range of services they can get. So it's connected also to that goal of the AAAs. In some places, you will see that the Ombudsman program is within the AAA. Sometimes it's connected to the AAA. Sometimes it's just housed in the AAA, and sometimes it's disconnected from the AAA. Ombudsmen also are the ones who are lobbying for health, safety, and welfare of long-term care consumers and aging adults. So you might see them in the legislature. Another big organization that I wanted to touch on, and you are also going to look at this week, is the AARP. The AARP is another really old organization. It's been around for 50, 60 years. The NCOA was also an advocacy membership organization, but really the AARP was distinguished because it was more of a paid membership. And they actually got involved with providing insurance. So AARP and NCOA sometimes look similar. They are actually different, but they are both provide pretty influential lobbying in both Washington and in the individual states. So that's it for week 3. I'm really looking for you guys to explore and look around at the various advocacy and professional organizations that support aging folks across the U.S. These were a couple of examples, but I'm hoping that you do some of your own research. As always, reach out with questions, comments, or concerns.